When we talk about increasing penile length, it's important to begin with science and not with myths. The truth is that most men who are worried about size actually fall within the normal range. Studies show that the average erect length is about 5 to 6 inches, and the average flaccid length is 3 to 4 inches. Understanding this baseline is the first step before considering any intervention. Now, the only scientifically proven method for non-surgical length enhancement is the use of penile traction devices, also known as extenders. Clinical trials have shown that when used daily for several hours over the course of 4 to 6 months, men may see an increase of about 1 to 2 centimeters in length. While this change is modest, it is real and backed by medical data. Another factor often overlooked is weight loss. Excess fat around the pubic area can create what's called a buried penis, where the base of the penis is hidden under the fat pad. By reducing body fat, particularly in the lower abdomen, more of the natural penile length becomes visible. This doesn't technically increase length, but it improves appearance and confidence significantly. Surgery is an option, but it comes with serious risk. Procedures like suspensory ligament release or fat injections can lead to complications, scarring, and even erectile dysfunction. For this reason, surgery is only recommended in very specific medical situations, such as trauma or congenital abnormalities, not for cosmetic purposes. Now, let's address pills, supplements, and herbal remedies. Despite widespread marketing, there is no scientific evidence that any pill or natural supplement increases penile length. In fact, many of these products can be unsafe, unregulated, and potentially harmful. It's important to separate fact from fiction and not fall prey to false promises. Finally, I want to emphasize that size is not the most important factor in sexual satisfaction. Confidence, intimacy, communication, and overall sexual health matter far more. Men who focus on their fitness, stamina, and emotional connection with their partner often report far greater satisfaction than those who fixate solely on length. So, while there are limited scientifically proven methods to modestly increase penile length, the bigger takeaway is this: understand your body, avoid scams, and prioritize overall sexual health and confidence. When it comes to concerns about penile length, one of the most important things to understand is what is actually considered normal. Research has consistently shown that most men fall within a very typical range, even though many believe they are below average. Studies that have measured thousands of men across different countries and ethnicities found that the average penile length in the flaccid state is around 3 to 4 inches, while the average erect length is about 5 to 6 inches. The variation is not as wide as people often imagine, and men who feel they are smaller than average usually still fall comfortably within this normal spectrum. Much of the anxiety surrounding size comes not from medical reality but from social pressure, comparisons, and unrealistic expectations created by media. Psychological perception plays a huge role in how men view their bodies. For instance, in surveys, a significant number of men report dissatisfaction with their size, yet when asked, most women indicate that they are satisfied with their partner's size and do not consider it a major factor in sexual satisfaction. This discrepancy shows that the concern is often internal rather than external. Body image issues, self-esteem, and confidence all influence how a man feels about himself, and penile size becomes an easy focal point for those insecurities. In reality, sexual performance, intimacy, and connection with a partner matter far more than actual measurements. Another aspect to consider is the way the penis looks in different states. A penis that appears small when flaccid may increase significantly in size when erect, while another that looks larger when flaccid may not grow as much. This is why comparing oneself to others based only on appearance at rest can lead to misleading conclusions. Factors such as temperature, stress, and even the amount of body fat around the pubic region can influence how long or short the penis looks in its relaxed state. It is also worth noting that many men compare themselves to unrealistic standards, such as images seen in pornography. These portrayals are often not representative of the general population and can create distorted expectations. Medical professionals emphasize that being within the normal range not only means adequate function, but also that size is not a barrier to fertility or sexual satisfaction. By recognizing what is medically normal, men can begin to shift their perspective away from unnecessary worry and toward focusing on overall health, confidence, and sexual well-being. Penile extenders, also known as traction devices, are one of the very few scientifically studied and medically recognized methods that can lead to a modest but measurable increase in penile length. These devices work on the principle of gentle, consistent traction. By applying a steady stretch to the penis for several hours each day, the tissues adapt over time through a process called cellular proliferation, where microscopic stresses encourage the cells to divide and gradually lengthen the structure. This is the same principle used in orthopedic medicine for limb lengthening procedures, though on a much smaller and more controlled scale. Clinical research has shown that when used properly and consistently, penile extenders can increase erect length by about 1 to 2 centimeters over a period of 4 to 6 months. While the numbers may not sound dramatic, they are significant because they are scientifically proven, unlike many of the unverified claims made by supplements or other marketed products. However, it is important to understand that these results require commitment. Most studies recommend using the device for several hours each day, which can be inconvenient and requires patience. Inconsistent or short-term use is unlikely to yield noticeable results. Another key consideration is safety. When used according to instructions, traction devices are generally considered safe, though some men may experience temporary side effects such as mild discomfort, redness, or irritation. These usually resolve once the device is removed or adjusted. It is crucial, however, not to overuse or apply excessive force, as this can cause injury. Consulting with a healthcare professional before beginning such therapy is strongly recommended to ensure proper use and to rule out any underlying conditions that may make traction unsafe. It's also worth noting that penile extenders primarily affect length and not girth. They may slightly improve curvature in men with conditions like Peyronie's disease, where scar tissue causes the penis to bend during erections, but the main measurable effect remains modest lengthening. Many men who use these devices report increased confidence, not just from the physical change but also from the sense of taking action, backed by science. Still, expectations must remain realistic. Extenders are not a quick fix or a way to dramatically change size, but rather a tool that, with time and dedication, can provide incremental but meaningful improvements. One of the simplest yet most overlooked ways to improve the appearance of penile length is through weight loss, particularly in reducing abdominal fat and the fat pad that sits just above the pubic area. This fat pad, medically called the suprapubic fat pad, can cover the base of the penis and make it appear shorter than it really is. In men who carry excess weight in the lower abdomen, a significant portion of the penis may actually be hidden beneath this fat, creating what is often referred to as a buried penis. Importantly, the true penile length hasn't changed, but its visibility has been reduced. By losing weight, more of the shaft becomes externally visible, often creating the perception of increased length. Studies have shown that even modest weight loss can make a noticeable difference. For example, losing 20 to 30 pounds can significantly reduce the size of the fat pad and uncover more of the natural penis. This change is not only cosmetic, but also has broader health benefits. Excess abdominal fat is closely linked with conditions such as diabetes, high blood pressure, and cardiovascular disease, all of which can negatively impact sexual health and erectile function. So reducing weight does not just improve the visible length of the penis, it also enhances overall sexual performance and confidence. Another point to consider is that fat distribution can vary among men. Some may carry more weight in the abdomen and pubic area, while others carry it elsewhere. For those with a prominent fat pad, the effect on penile appearance can be quite dramatic. In certain cases, men who undergo significant weight loss, either through lifestyle changes, medical management, or bariatric surgery, report not only feeling healthier, but also experiencing a noticeable difference in how their penis looks and functions. It's also important to understand that this improvement is natural and safe, unlike risky procedures or unproven products marketed as size enhancers. Weight loss doesn't actually lengthen the penis, but by revealing more of what is already there, it creates a real, visible improvement without side effects. In fact, some men who combine weight loss with exercise report feeling more energetic, improving stamina, and performing better sexually. This reinforces the idea that overall body health and fitness are directly connected to sexual confidence and satisfaction. By managing weight and reducing excess fat, men can gain not just visible length, but also improved health and quality of life. Surgical options for penile lengthening are often discussed in online forums and marketed aggressively, but in reality, they are rarely recommended and generally reserved for men with very specific medical or reconstructive needs. Examples include congenital abnormalities, severe penile shortening due to conditions like Peyronie's disease, or cases of trauma where reconstructive surgery is required. In these situations, surgery may be appropriate to restore function, improve appearance, or correct deformity. However, for men who are otherwise healthy and only concerned with cosmetic enhancement, surgical procedures are considered high risk with limited long-term benefits. One of the most commonly advertised surgeries is suspensory ligament release. This involves cutting the ligament that anchors the penis to the pubic bone, allowing more of the internal portion of the shaft to drop forward and appear longer externally. While this may add a small increase in flaccid length, it does not typically increase erect length and can sometimes even cause instability, resulting in an awkward angle during erections. Other techniques, such as fat grafting or dermal fillers to increase girth, come with risks like uneven results, resorption of the injected material, scarring, or lumps that can negatively impact both appearance and function. The complication rates for cosmetic penile surgeries are relatively high compared to the modest results they provide. Men may experience infection, scarring, reduced sensation, or even erectile dysfunction in severe cases. Furthermore, many patients report dissatisfaction despite undergoing the procedure, often because expectations were not realistic to begin with. This highlights the importance of psychological counseling and education before considering any invasive option. Another area of surgery that is sometimes discussed is penile prosthesis placement, but it is important to clarify that this is not intended for size enhancement. Prostheses are used in men with severe erectile dysfunction who do not respond to medication, and their purpose is to restore rigidity for intercourse, not to lengthen the penis. For these reasons, most urologists strongly caution men against pursuing surgical lengthening procedures, unless there is a clear and compelling medical indication. Non-surgical approaches, lifestyle improvements, and realistic expectations are almost always safer and more effective pathways. While surgery may sound appealing for those who are deeply concerned about size, the reality is that the risks often outweigh the potential benefits, and the outcomes rarely match what men hope to achieve. When it comes to pills and supplements that claim to increase penile length, the scientific evidence is clear. None of them work. Despite flashy advertisements and bold promises, there is no clinically proven supplement that can permanently or reliably increase the size of the penis. Many of these products are marketed using testimonials, manipulated images, or pseudoscientific jargon to convince men that they are effective. However, when these claims are tested under rigorous medical studies, the results show no measurable improvement in length or girth. What's even more concerning is that some of these products can be harmful, as they are often unregulated and may contain hidden or unsafe ingredients. Most of these pills are filled with herbal blends that sound appealing, such as ginseng, ginkgo biloba, or yohimbe, because they are associated with energy, circulation, or sexual function. While certain herbs may have minor effects on improving blood flow or erectile quality, none of them stimulate tissue growth that leads to increased size. In fact, the U.S. Food and Drug Administration, FDA, has repeatedly issued warnings about male enhancement supplements, finding that many contain undeclared pharmaceutical drugs like citinline, the active ingredient in Viagra, which can interact dangerously with other medications or medical conditions. The bigger issue is that these products prey on insecurities. Men who feel anxious about their size are more likely to buy into the promise of a quick, easy fix. Unfortunately, this often leads to wasted money, disappointment, and in some cases, health risks. Beyond that, relying on unregulated supplements can delay men from seeking legitimate medical advice for concerns like erectile dysfunction, which might actually be caused by treatable conditions such as diabetes, hypertension, or low testosterone. It's also important to remember that the penis, unlike muscles, cannot be enlarged through nutrition or supplementation. Tissue growth in the penis does not respond to vitamins, minerals, or plant extracts the way muscle tissue might respond to protein or exercise. What these supplements may do, at best, is temporarily improve erectile rigidity, which could make the penis appear fuller during arousal, but this should not be confused with true enlargement. For men who are genuinely interested in improving their sexual health, focusing on a balanced diet, exercise, weight management, and addressing underlying health conditions is far more effective. These natural approaches not only enhance performance and confidence, but also carry long-term benefits for overall well-being. Pills and supplements may seem tempting because they promise fast results, but the reality is that they are marketing scams designed to take advantage of vulnerability rather than deliver real science-backed solutions. When discussing sexual satisfaction, it's essential to recognize that performance, intimacy, and confidence play a far greater role than penile size. Multiple studies have shown that the majority of women are satisfied with their partner's size, and in many cases, it is not even a significant factor in their overall sexual fulfillment. What matters much more is the quality of the relationship, the ability to communicate openly, and the confidence a man brings into the bedroom. A confident partner who understands intimacy, takes time to engage, and focuses on mutual pleasure will almost always create a more satisfying experience than someone who is fixated on measurements. Confidence is one of the most powerful aspects of sexual health. When a man feels comfortable with his body and trusts his ability to satisfy his partner, that confidence translates into better performance and stronger intimacy. On the other hand, insecurity about size can create anxiety, which often leads to problems such as erectile dysfunction or premature ejaculation. This becomes a self-fulfilling cycle, where worry about size diminishes performance, reinforcing the very insecurity that caused the anxiety in the first place. Addressing self-esteem and body image, therefore, is just as important as any physical factor when it comes to sexual satisfaction. Another key factor is function. A penis of average size that can achieve and maintain a strong erection will provide far greater satisfaction than a larger penis that struggles with rigidity. Functionality depends on good blood flow, nerve health, and overall wellness, which are all influenced by lifestyle choices such as diet, exercise, and avoiding smoking or excessive alcohol use. Men who take care of their cardiovascular health often find that their sexual performance improves as a natural result, highlighting that function is far more valuable than size. Intimacy also plays a central role. Techniques such as foreplay, emotional connection, communication, and attentiveness to a partner's needs are all strongly linked to sexual satisfaction. Surveys repeatedly show that women value these qualities much more than penile length. By focusing on building closeness, practicing patience, and prioritizing mutual pleasure, men can create a fulfilling sexual experience regardless of their size. Ultimately, the pursuit of size often distracts from the more meaningful aspects of sexual relationships. Shifting focus toward function, intimacy, and confidence not only improves satisfaction, but also strengthens the overall bond between partners. Instead of measuring success in inches, it is far more impactful to measure it in connection, trust, and the ability to create shared pleasure. While many men worry about penile length, the truth is that most fall well within the normal range, and insecurities are often shaped more by perception than reality. Scientifically supported methods like traction devices can provide modest gains, and lifestyle changes such as weight loss can make a visible difference. But the dramatic promises made by pills, supplements, or unregulated procedures are simply not supported by evidence. Surgical options remain limited to medical necessity and come with significant risks that outweigh potential benefits in most cases. What truly matters is function, intimacy, and confidence, factors that consistently contribute more to satisfaction than size ever could. By focusing on overall health, communication, and self-assurance, men can experience not just better sexual performance, but also stronger relationships and improved quality of life.